cancer survivor's experience in mind has changed that experience for my husband and myself since 2006. We have never been separated. You'll hear the same thing from Nettie when she speaks. We're never separated except in the operating room through chemotherapy, radiation, and surgery. And I like to point out to people that even when I had 3 biopsies, my husband was able to be in mammography with me. The care providers put a lead apron on him. He stood behind me. He helped to hold me up. He was part of the care experience. That is participation. That enhances the individual's control and their sense of independence in the health care experience. And lastly, but probably most importantly, this whole process is about collaboration in how we build health care and build it from the perspective of patients and families so it truly meets their needs. And we are doing that here in every aspect of professional education, and we're also doing it in the research work that we're doing at MCG. Oh, here we go. Okay, a little story just to bring the point home, and this is my granddaughter, my oldest grandchild, Caroline, who's now 4, doing very well, but when she was 5 months old, she was living with her parents in New York City. She acquired something called infant botulism. Infant botulism causes total body paralysis for the infant. You can breathe a sigh of relief because this does not happen. There are no cases in the South. This just happens in the North and the Northwest, and it's very rare, only about 100 cases a year. In any case, we were very fortunate. We got our beautiful grandchild into a fine children's hospital in New York City, and I spent the next 10 days with my daughter and son-in-law in that pediatric intensive care unit. And even though I had worked on all these issues of how partnerships are so important to patients and families with their caregivers, I learned some things in this experience. I first of all learned that while everyone would answer our questions in the healthcare facility, there were just a few people that really talked to us. And I think that's an important part of patient and family-centered care, the willingness to enter into a dialogue with patients and families. And it was in one of those conversations in the middle of the night with a pediatric critical care fellow where we were able to identify a antitoxin for botulism that was available in California, had just gotten on the market, basically. And I think things really got going because of that conversation. And 24 hours later, I was standing over my granddaughter's bed and took this picture as she just flipped her little finger, her thumb, and lifted her eyelid. And even to me, this picture just meant so much because even a 5-month-old wants to know what's going on. And so here she is today. So she's just a happy child. And we are so grateful as a family for the care that she received at this pediatric facility. And what I learned is that in that experience, my daughter and my son-in-law were that baby's support, and I was my daughter and son-in-law support, and that's how it worked in our family. And I think that's what we have to look for in every healthcare experience is what is it that people need, what is the makeup of their family. It may not be a blood relative, it might be a best friend who can be their advocate and be with them. We need to support that. So now we want to ask a question and of the audience and just take a poll. And the question is, have you ever experienced patient and family-centered care as a patient, family member, or caregiver? And your answers are yes, no, don't know, and we'll just give you 10 seconds to complete the poll. It looks like those of you that are responding, that many of you have had an experience where you can recognize that you have had patient and family-centered care or experienced it. So our poll says of those of you that responded, 83%. So that's very, very good. Well, let's talk just a little bit more about some kinds of care that exist. These next three cartoons are courtesy of the Institute for Family-Centered Care, which is a resource to all of those who are listening, FamilyCenteredCare.org, for a lot of assistance on patient and family-centered care. But these were cartoons drawn by a woman with lupus who had had lots of health care experiences. And we asked her to tell us what does system-centered care look like. And this was the cartoon she drew. And up at the top you see individuals going into this big machine. This is the healthcare system. And everybody in this is individuals when they go in, but the way they treat it and how they come out is not as individuals, but as we all are alike. And of course, we are not all alike. Each one of us has unique needs in terms of our individuality and our family makeup, and all of that needs to come into play in healthcare. And here you see the healthcare providers manipulating parts of the system, but they aren't really working together, are they? So now, here is another kind of care. It's called patient-focused care, where at least we're focusing on the patient here and maybe as an individual. But you see the healthcare providers that are manipulating the person aren't necessarily working together. They're working with various parts of the individual's anatomy, and these little people up here are meant to be the person's family, and they don't play a very significant role. And what you see from this is the individual's not really in control of the process, and they certainly aren't a partner. Now here is something also called family-focused care, and we're getting closer to these little people down here. This is the family, and so we're getting closer to looking at the family, but look at how they're treated. This is the all-knowing, all-seeing healthcare professionals, and we're under the microscope. Anybody ever had that kind of feeling in a healthcare experience? It's not a particularly good one. So what does patient and family-centered care look like? Well, we don't have a cartoon. But what we do have is, and what I like to use is this picture, because what it shows is, and this was a story published in Advance for Nurses from our Neurosciences Center of Excellence, and it shows a caregiver, Gary Collins, with Mr. and Mrs. Odom. Mr. Odom is the patient and Mrs. Odom his wife, and they're all working together. They're at eye level. You can tell that there is a back and forth of understanding. You can see respect and dignity, information sharing, participation, collaboration in this picture. So this begins to give us a visual of what does patient and family-centered care look like. There's a bit of history. We won't spend much time on this because we don't have that much time today. But for those of you that are interested, you can go back and begin to look at the work that started in the 1980s. Surgeon General Koop, working with families of children with special needs, was where family-centered care really came into being. Plaintree, which was a unique kind of patient care unit that developed in California, which really put a lot of focus on a more holistic approach and enhancing the facilities supporting patient care. And then the marvelous book, Through the Patient Eyes, published in 1993, was where the patient-centered care definition started to come into being. All of that being put together and now really being advanced by the Institute of Medicine, the American Hospital Association, the IHI, and a whole group of other national organizations, including the Joint Commission, leaders for our military health care, and leaders for graduate medical education are now all working on patient and family-centered care. What it is not. Families are in charge and we just do what they want. Sometimes we really have to work with our staff to make sure they understand this really is about partnership and it's a two-way street.